everybody. I am Dr. Amit Jaiswal. I am a consultant neurosurgeon with AMRI Group of Hospitals based out of Bhubaneswar. As we all know, we are going through a tough times dealing with this global pandemic called COVID-19. We all continuously are being bombarded by informations about COVID-19 in terms of its presentation, manifestations, symptoms, what all things happen routinely. Yes, last year we saw that how the presentations were and now how it has changed. Predominantly, as everybody knows, pathognomonic of COVID-19 infection initially, in most of the cases, is loss of taste and smell. But now, over past few months, we have seen there are group of patients who also present with neurological manifestations. In predominantly the most common neurological manifestation we find in these group of patients is headache, and also patient presenting with the term called as brain fog. Now, brain fog is one thing which is being seen very commonly in these group of patients, specifically young age group. That I am talking about the age of 30 to 50 year old patients. They complain of loss of concentration. They complain of off and on headaches, which is new in origin, and when they are being tested, they turn positive. So when it's an appeal to all of you, when anybody of you or your family members start complaining of headaches, loss of concentration, brain fogging, it's imperative that we all take medical advice. You should not take medications, over the counter medications to treat yourself. Please consult immediately a doctor and your investigation, and get yourself investigated and treated. So now, neurological manifestations of COVID-19 are varied, right from, as I told, headaches, brain fogging, loss of concentration, fatigue. Fatigue is also one thing which is very commonly seen. People, they feel, it's called as a chronic fatigue syndrome. They feel tired throughout the day. Don't know why. They attribute it to various reasons, to changes, to stress, to depression. But if anybody is facing these symptoms, immediately please consult your doctor and get yourself tested. More severe form of neurological manifestation now, which is patients are presenting to us, is with strokes. Why stroke? Brain stroke means any acute catastrophic event that happens in the brain, and this COVID-19 virus, the spike protein of COVID-19 virus, it goes and attaches itself to the endothelial cells of blood-brain barrier, which leads to changes in the brain, and also it changes the coagulation system and coagulopathies, which leads to brain hemorrhages, which present to us like brain strokes. So now we are seeing patients coming to us who were absolutely normal without any associated comorbidities directly presenting to us with brain strokes, and ultimately they turn out to be COVID positive. So now this is very common that we should also be aware of certain neurological manifestations which this virus, this deadly virus can present as. And so how do we know, how do we deal with this? Most important is, first, please keep a tab on your symptoms, don't neglect it, and don't try to avoid going to a doctor during these times. It's so important that you protect yourself, you protect your family as well as the society. And I would appeal that we can fight it together, and we'll do it together and come out in a positive way. Thank you.